ಸರ್ ಇದಕ್ಕೆ ರೀ ಹಾಂ ಕೊಟ್ಟಿವಿ ಸರ್. ಮಾಡ್ತೀರಿ ಅಡ್ಮಿಟ್ ಅಂತ ಹೇಳ್ಬೋದು ನೋಡ್ರಿ.
ವಿಜಯನಗರಿ ಇದು ನಿಮ್ದೇನ್ರಿ ಮಾತು
ಇದ್ರದ್ದು
ಸೌಂಡ್ ಬಂದ್ ಮಾಡಿ ನೋಡ್ರಿ.
ಬಂದು ನೋಡ್ರಿ ಸೌಂಡ್ ಅಡ್ಮಿಟ್.
ಚಲೋ ನೋಡ್ರಿ.
ಹಾಂ ಕೊಟ್ಟಿವಿ ಸರ್. ಸರ್ ಕಪ್ ಸರ್ ಈ ಅಡ್ಮಿಟ್ ಮಾಡ್ಕೊತಂದ್ರೆ ಸರ್.
ಲಿಂಕ್ ಕಳ್ಸತ್ತಾರೆ ಸರ್.
ಸರಿ
ಸರ್ ಜಯನಗರ
ಆದ್ರೆ ಅಡ್ಮಿಟ್
ಸರ್ ಜಾಯ್ನ್ ಆದ್ರಿ. ಓಕೆ ಸರ್.
ಅಷ್ಟು ಮಾಡಿರಿ ಸರ್.
ಇದ್ರಾಗ ಆಗ್ಬೇಡ ಅಂತ ಹೇಳ್ರಿ.
ಇದು ಯಾರ್ಯಾರ
ನೋಡ್ರಿ
ಇಲ್ಲ ಇಷ್ಟೇ ಜನ ಅವರು ಅವ್ರ ಪರ್ಫಾರ್ಮೆನ್ಸ್ ಇದು ಮಾಡೋ
ಕ್ಯಾಮ್ರಾ ಆನ್ ಐತ್ರಿ. ಆಯ್ತು ಈಗ ಸರ್ ಹಸ್ಬೆಂಡ್ ಸರ್ ಕೊಟ್ಟು ಕಳಿಸ್ತಾರೆ ಸರ್. ನೀವು ಓಕೆ ಇಲ್ಲ ಆಗ್ಬಿಡ್ತಾರೆ. ಏ ಬಲ್ವಾ ಏನೋ ಎಡದಾಗ ಎಂಟಾತ್ಲ
ಇದೇ ನಾನು ಮಗಳಾಗ 45-50 ಕಿಲೋಮೀಟರ್ ದೂರದನಿ
ಪ್ರೆಸೆಂಟಿಂಗ್ ಮಾಡಕ್ ಪ್ರೆಸೆಂಟ್ ಸ್ಕಿಲ್ ಪ್ರೆಸೆಂಟ್ ಅಲ್ರಿ ಇದನ್ನ ಇದು ಮಾಡಕ್ ಬರ್ತೈತಿ
ಇದೇ ಮೀನ್
ಎರಡು ಐತಿತ್ತೇಳು ಕ್ಯಾಮ್ರಾ ಅಡ್ಡ ಐತಿತ್ತೇಳು ಸೀದಾ ಹಿಡಿತೇಳು ಎಲ್ಲ ಸರ್ ಅಲ್ಲೇ
ಮದಿನೇ ನಾನೇ
ಬಂದಿದ್ಲೆ ಹಾಂ ಯೂಟ್ಯೂಬ್ ಲಾವೇ ಐತಿ
ನಂದು ಇಟ್ಟಿನ್ರಿ ನಂದು ಸೂಮ್ ಬರ್ಬೇಕು
ಸರ್ ನಿಮ್ದು ಹೆಂಗೆ ಐತೆ ಗೊತ್ತನ್ರಿ ಅಡ್ಡ ಐತ್ರಿ ನಿಮ್ದು ಕಿಲ್ಲಿ ಐತೆ ಹಿಂಗೆ ಐತ್ರಿ ಹಿಂಗೆ ಹಿಡಿಬೇಕು ನೀವು ಕ್ಯಾಮ್ರಾ
ಹಿಂಗೆ ಹಿಡಿಬೇಕು ನಾವು
ಹಾಂ
ಅದು ನಾನು ಸೀದಾ ಹಿಡಿದ್ರೆ ಸರ್
ಹಿಂಗೆ ಅಂಟಿಟ್ಟಿರಿ ಸ್ಟ್ಯಾಂಡ್ದಾಗ ಇಟ್ಟಿವಿ ಸ್ಟ್ರೇಟ್ ಸೀದಾ ಇಡಿ
ಸೀದಾ ಹಿಡಿದ್ರೆ ಸೀದಾ ಕಾಣಿಸುತ್ತೆ ಕಾಣಿಸಲ್ಲ ಸರ್ ಕಾಣಿಸ್ಲೇನ
ಆಫ್ ಮಾಡಿಲ್ಲ
ಏನು ಎರಡು ಆಫ್ ಮಾಡಿ ಸರ್ ವಿಡಿಯೋ ಆಡಿಯೋ ಎರಡು ಆಫ್ ಮಾಡಿ
ಇದು ಈಗ ಝೂಮ್ ಮಾಡಿರ್ಬೇಕು ಇದೇ ಮೀನು ಕಾಣ್ಬೇಕು ಸ್ಕ್ರೀನ್ ಇದು ಪಿನ್ನಿಂಗ್ ಮಾಡ್ಬೇಕು
ಹಾಂ ಎಸ್ ಈಗ ಸೀದಾ ಕಾಣಕೈತೆ ಸ್ವಲ್ಪ ಹಿಂದೆ ತಗೋತಾಳೆ ಸರ್ ಬರ್ಮಕ್ಕೆ ಫೋನ್ ಹಚ್ಚನ್ ಸರ್
ಲಾಸ್ಟ್ ಎಲ್ಲ ಆದ್ಮೇಲೆ ಇನ್ನೂ ಪ್ರೋಸೆಸ್
ಬಲ್ಮಾ ಇಲ್ಲ ಇನ್ನೂ ಅಡ್ಡಾತು ಈ ಕಡೆ ಅಡ್ಡಾತು ಈಗ ಅದು
ಸ್ಟ್ರೇಟ್ ಮಾಡೋದು ಸ್ಟ್ರೇಟ್ ಹಾಂ
ಸ್ಟ್ರೇಟ್ ಮಾಡೋದನ್ನ
हां तुम्ही केला सगळं मॅडम डिस्कस
हां मी केलं रात्री पण ते
हां यस सर
मॅडम याला
हां करेक्ट आहे बरोबर
ते
आहे
कधी करणार आहे
ते लास्टला आहे
क्लासला
मी तुम्हाला सांगतो
लो ಹಾಂ ಇದು ಕರೆಕ್ಟ್ ಐತೆ ನೋಡಿ ಈಗ ಹಿಡ್ದದ್ದು
ಈ ಕರೆಕ್ಟ್ ಹಾಂ ಓಕೆ ಓಕೆ ಡನ್
ಏ ಅದನ್ನ ಫಿಕ್ಸ್ ಮಾಡಿಬಿಡ್ಲ ಇದ್ರಾಗ ಸೀದಾ ಇಟ್ಟ ಯಾಕೆ ಸೀದಾ ಟರ್ನ್ ಮಾಡಿದನು ಸ್ಟ್ಯಾಂಡ್ನಾಗಿಲ್ಲ ಸ್ಟ್ರೇಟ ಪೋರ್ಟ್ರೇಟ್ ಇರ್ತೈತೆ ನೋಡು ತಿರ್ಸ್ಲ ಅದನ್ನ ಇದನ್ನ ರೊಟೇಟ್ ಹಾಕಿ
ಹಲೋ ಹಲೋ
ಹಾಂ ಸರ್ ಅಡಿಬಲ್ ಐತ್ರಿ
Yes, sir.
ಕ್ಯಾನ್ ಯು ರೆಡಿ ಟು ಸ್ಟಾರ್ಟ್
Yes, sir.
ಎಸ್ ಸರ್ ಬರ್ ಎಸ್ ಯು ಕ್ಯಾನ್ ಸ್ಟಾರ್ಟ್ ಓಪನ್ ಯುವರ್ ವಿಡಿಯೋ
Okay, sir. Good morning, everyone. As we all are present here to celebrate the auspicious day of International Yoga Day, as addressed by Honorable Prime Minister of India.
ಆನ್ ಯುವರ್
Yes,
ವಿಡಿಯೋ
sir. Yes, sir. After Safa Yoga demonstrators.
ಕೊಟ್ಟಿದ್ರಲ್ಲ
ಏನು ಶೇಂಗಾದಲ್ಲ ಯಾರ್ಯಾರು ಯೋಗ ಮಾಡೋರು ಹೋಗ್ರಿ ಮುಂದೆ.
ಸಕ್ಕರೆ ತಿನ್ಬೇಡ.
ಹಂಗ ತಗೋರಿ ನಾನು ತುನು ತಿಳ್ಕೊಂಡ್ರಿ ನಿಮಗೆ ನಾನು ತಿಂದ್ರೆ
ಪಾಪ ಮನ್ಯಾಗ ತಿನ್ನು ಹುಡಲ್ರಿ ಇಲ್ಲರ ಒಂದು ಸ್ವಲ್ಪ ತಿಂದು ಬಿಡ್ರಿಲ್ಲ ರೀ.
ತಿಂದು ದೌಡ್ ಹೋಗ್ತಾರೆ ಎಲ್ಲ
ಸ್ವಲ್ಪ ಆಸೆ ಇದ್ದಿದ್ದು
ದೌಡು ಬಂದ್ರೇನು
ದೌಡ್ ಕಳ್ಸೋ ಮೇಲೆ ಭಾಳ ಐತೆ ಸರ್ ಇಲ್ಲಿ
ಇಲ್ರಿ ಸರ್ ನಾಲ್ಕಲ್ರಿ
ಈಗ ನಾಷ್ಟ ಏನು ಮಾಡೋದು?
ಮನೆಗೆ ಹೋಗ್ತೀವಿ
ಎಷ್ಟು ಚಂದ ಹೊಂಟಿದ್ರಿ ಎಲ್ಲ.
ಇದು ಜನ್ರೇಟ್ರ್ ಮೊದಲೇ ಯಾಕೆ ಆನ್ ಮಾಡಿಲ್ರಿ? ಯಾರು
ಯಾರು ಇರ್ತಾರೆ ರೀ ನಾವು
ಹೇಳಿದ್ದು ನಾನು ಮೊದಲು ಹೇಳಿದ್ದೆ ಅದಕ್ಕೆ.
ಸರ್
ಹ್ಞೂ
ಬಂದಿಲ್ಲ ಸರ್
ಯಾವ್ದು ರೀ? ಬಂದಿಲ್ಲ ಯೂಟ್ಯೂಬ್ ಹೋದ ಕೂಡಲೇ ಅದು ಜನ್ರೇಟ್ ಆನ್ ಇಲ್ಲ.
ಭಾಳ ಹೈಟೆಕ್ ಬೇಕು ರೀ ಹಿಂಗೆ ನೆನಪಿ ಕಲ್ಸಲ್ಲ
ಖರ್ಚು ಮಾಡ್ತೀವಿ ರೀ ಇದನ್ನು
ಜನ್ರೇಟ್ ಆನ್ ಇಲ್ಲ.
ಇಟ್ಟು ಗಂಟೆ ತೋರ್ಸಲ್ಲ. ಯೂಟ್ಯೂಬ್ ಚಾಲು ಆಗೈತ್ರಿ.
ಬಂದ್ಬಿಟ್ಟು ನಾವು ಚೆನ್ನಾಗೈತೆ. ಈಗ ಸ್ಟಾರ್ಟ್ ಐತೀನಿ ಇನ್ನೂ ಬರಲ್ಲ ಪೂರಂದು ಬರ
ಕನೆಕ್ಷನ್ ಆಗದಾವ್ರಿ ಸರ್ ಏನು ಹಾಕತ್ರಿ ಕನೆಕ್ಷನ್ ಹಂಗೈತ್ರಿ ಇದು ಇದಕ್ಕೆ ಭಾಳ ಹೈ ಸ್ಪೀಡ್ ನೆಟ್ ಬೇಕು ರೀ.
ಹಾಟ್ಸ್ಪಾಟ್ ತೊಗೊಂಡ್ರಿ
ಹಾಟ್ಸ್ಪಾಟ್ ಐತೆ ಸರ್ ಈಗ ಇದು. ಯಾವ ಹಾಂ ಸೂಪರ್ವೈಸರ್ ಮಾಡ್ತಾರೆ ರೀ. ವಿನಯ್ ಸೂಪರ್ವೈಸರ್
ಫಂಕ್ಷನ್ ಗೊತ್ತಿರಲ್ಲ ಎಲ್ಲನೂ
ಎಲ್ಲನೂ ನಮ್ಗೆ ಬೇರೆ.
ಮತ್ತು
ಈಗ ಕರೆಂಟ್ ಬಂದ್ರಿ ಮೇಡಮ್, ಅಲ್ಲಿ ಸೈಡ್ ಬಟನ್ ಅಂತ ಸ್ಟಾರ್ಟ್ ಆಗಿತ್ತು.
ಸಂಸ್ಕೃತಿ
Yes, sir. After Sumo Yoga demonstrated.
ಬರ್ರಿ ಸರ್.
ಹೋಸ್ಟಿಂಗ್ ಸ್ಟೇಷನ್ ಕಾಂಟ್ ಸಿಂಗ್ ಮಾನಸಿ ಗುರು ಅಂತ ನೋಡ್ರಿ, ಮಾನಸಿ ಗುರು ನೋಡ್ರಿ, ಮಾನಸಿ ಎಸ್ ಸರ್ ಕನೆಕ್ಟ್ ಆಗಿದೆ ಸರ್.
ಕನೆಕ್ಟ್ ಆಗ್ತದೆ.
ಹಲೋ
ಯೂಟ್ಯೂಬ್ ಹೋಗಿ ಸರ್.
ಈಗ ಅವ್ರದ್ದು 8 ಅನುಕೂಲದ ಮಾಡ್ರಿ ಇದು ಹೆಂಗಾರ ಆಗಲಿ ಈಗ ಅವ್ರದಾರ ಮೇಡಮ್ ಕರೆಕ್ಟಾಗಿ ಬರ್ಬೇಕು. ಈಗ ಇನ್ನೊಂದು ಕ್ರಿಯೇಟ್ ಮಾಡ್ಬೇಕು ಮತ್ತೆ ಇಲ್ಲ ಸರ್ ಆಗ್ತೈತೆ
ಅದಕ್ಕೆ ಆಗೈತೆ ರೀ.
ಅದೇನು ಬರೋಲ್ಲ
ಅವರು ವಿಡಿಯೋ ಸ್ಟಾರ್ಟ್ ಮಾಡಿಲ್ಲ ಸರ್.
Demonstrators, please start your video.
ವಿಡಿಯೋ ಸ್ಟಾರ್ಟ್ ಮಾಡಂತ ಹೇಳ್ರಿ.
ನೀವು ಮೈಕ್ ಆಫ್ ಇಡ್ರಿ ಎಲ್ಲರೂ ಇನ್ನೂ ಆಫ್ ಇಡ್ರಿ ಸರ್ ಹೇಳ್ಬೇಕಾದ್ರೆ ಹಾಂ
ಇದು
Demonstrators,
ಯೂಟ್ಯೂಬ್ ರೀ. ಯೂಟ್ಯೂಬ್
please start your video.
ಯೂಟ್ಯೂಬ್ ಅಂತ ಸರ್ ನೋಡಿ. ಸ್ವಲ್ಪ ಇದಕ್ಕಿಂತ ಸ್ಲೋ ಬರ್ತದೆ ಸರ್.
ಬರೀ ಚಲೋ ಆಗಿಸಲ್ಲ
ಚಲೋ
ಎಲ್ಲೇ ಯಾರು
ಇದ್ರಿ ಮಹರ್ಷಿ ರೀ.
ಸ್ವಲ್ಪ ಸ್ಟಿಪ್ಯುಲೇಟ್ ಅಂತ
Now first we will start with the neck bending. Forward and backward bending.
ಫಾಸ್ಟ್ ಮಾಡಿ
Stand with the feet comfortably apart.
ಹೇಳ್ಬಿಡ್ರಿ ಅವ್ರಿಗೆ ಬೇರೆ ಪರ್ಸನಲ್ ಹೇಳ್ರಿ
Keep the hands straight beside the body.
ಎಲ್ಲರಿಗೂ ವಿಸಿಬಲ್ ಆಗ್ಬಿಡ್ರಿ
Keep your arms on the waist. While exhaling, move the head, try to touch the chin to the chest.
ಮತ್ತೆ ಕರೆಕ್ಟ್ ಆಗುತ್ತೆ ಮುಗಿ ಮಟ್ಟ ಈಗ ಏನೋ ಎಲ್ಲ ಇಟ್ಕೋ ರೆಡಿ ಮಾಡ್ಕೋ 8 ಗಂಟೆಗಳು
While inhaling, move the head as far as back as is comfortable. This is 1 round. Repeat 2 rounds.
ವಿಡಿಯೋ ಸ್ಟಾರ್ಟ್ ಮಾಡಿಲ್ಲ ಸರ್.
Demonstrators, please start your video. Right and left bending. While exhaling, bend the head slowly to the right. Bring the ear as close as possible to the shoulder without raising the shoulder. While inhaling, bring the head to the normal position. Similarly, while exhaling, bend the head to the left side. Inhale and bring the head up to the normal position. Repeat for 2 rounds. Now, right and left twisting. Keep the head upright. While exhaling, gently turn the head to the right so that the chin is in the line with the shoulder. While inhaling, bring the head to the normal position. Similarly, while exhaling, turn the head to the left. Inhale and bring the head to the normal position. Two more rounds. Neck rotation. Exhale. Bend the head forward, trying to touch the chin to the chest. slowly rotate the head clockwise in the circular motion. Exhale while coming down. Do a full rotation. Then rotate the head in anti-clockwise direction. Inhale. Go back and exhale. Repeat it for 2 rounds. Now, the trunk movement. Trunk twisting. Keep the legs about 2 to 3 feet apart. Rise both the arms up to the chest level with palms facing each other and keep them parallel. While exhaling, twist the body towards the left side so that the right palm touches the left shoulder. Come back with the inhalation. While exhaling, twist the body towards the right side so that the left palm touches the right shoulder. Come back with the inhalation. Relax in Samasthiti and repeat it for 2 more times. Now the knee movement. Inhale, lift your arms up at the shoulder level, palms facing downwards. Exhale, bend the knees and bring down your body to the squatting position. In the final position, both arms and thighs should be parallel to the ground. Inhale and straighten the body. Exhale while bringing down the hands. Repeat 2 more times. Now, standing postures. Tadasana. Stand with feet 2 inches apart. Interlock fingers and turn the wrist outward. Now inhale, raise the arms up and bring them in the line with the shoulder. Raise the heels off the floor and balance on the toes. Stay in the position for 10 to 15 seconds. Exhale, bring the heels down. Release the interlock of fingers and bring the arms down parallel to the trunk. Now, Vrukshasana. Stand feet stand with feet 2 inches apart. Focus on a point in front. Exhale and place the foot on the inside. The heel should be touching the perineum. Inhale and extend arms up and join the palms. Stay in the position for 10 to 30 seconds and breathe normally. Exhale and bring the arms and right foot down. Relax and repeat the asana by bending the left leg. Repeat the asana in the same manner. Relax your body. Pada Hastasana. Stand straight with feet 2 inches apart. Inhale slowly and raise the arms up. Stretch up the body from the waist. Exhale and bend forward until the trunk is parallel to the ground. Exhale and bend forward until the entire palms rest on the ground. Maintain this final posture for 10 to 30 seconds. Now inhale, come up slowly to the vertical position and stretch the arms above the head. Exhale and slowly return to the starting position in reverse order and relax your body. Now Ardha Chakrasana. Support the back at the waist with all fingers together pointing forward and downward. Drop the head backward and stretching the neck muscles. As you inhale, bend backward from the lumbar region. Exhale and relax.
Yoga is a art of to attain Hitayu and Dirgayu. For a healthy and happy life, we should follow Traya Upastamba and Dinacharya and Rutucharya, Ratricharya. Okay, so we have to follow Traya Upastamba, that is Ahara, Nidha, and Brahmacharya. Along with that, we have to follow Dinacharya, Rutucharya, and Ratricharya. Okay, so our Dinacharya, Rutucharya, always it used to change according to Rutu. In every Rutu, so particular in summer season, that is in the Grishma Rutu, what lifestyle we have to adopt, and in the winter Rutu, now in the Varsha Rutu, sunset takes place, what we have to take, which kind of food we have to take, how much we have to do the exercise. All together it used to come, then only we can maintain the health. Okay, so to maintain, to get a Hita Ayu and a Dirga Ayu, we have to follow Trayopastamba and we have Ritucharya and Ratricharya. Okay, so for this, our Acharya, Charakacharya has given a beautiful quote to maintain all these things, that is, to follow all these things. One basic need is required, that is to maintain Dinacharya, Ritucharya, Ratricharya, Trayopastamba, all these things we have. Basic need is we have to love ourselves. When we used to love ourselves, then we used to give the prime importance to ourselves. When we know to love ourselves, then only we can love others also. That's why the Acharya Charkacharya given the beautiful quotation that Nagari Nagara Sevarata Sevarati Sharirasya Medavi Puteshwa Vahito Bhavet. So what he told that who know how to keep himself healthy and happy, then that person can keep others also healthy and happy. If take an example of a mother, if the mother is the head of the family usually, so what happens if the mother family is out of mood, if she is not keeping well, if she is not happy, if she is not healthy, so that shows. Hello, 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 sir. In the sir. ಹೌದಾ ಓಕೆ ಸರ್ ಅದು ಇದು ಆಗಕತ್ತದ ಸರ್ ಆಡಿಬಲ್ ಐತೆ to get a good health, first and foremost thing our acharyas told to love ourselves. When we used to take care of ourselves, that is Swasharirasya Medavi. So when we used to take care of ourselves, then only we can take care of others also. Okay. So as I am giving the example of a mother, if the head of the family, the mother is out of mood, if she is not keeping well, then it shows the whole family in the house something went wrong. Okay, if she is not keeping well, that whole family will be affected. So if the mother is happy, if the head of the institution, whatever you may take, if you are happy, then you can give that vibration to your surrounding. If you are happy, you can give that positive vibration to your child. So keeping ourselves happy and healthy is the basic thing to get a health. So if you are healthy, then you can give the good health to others. That's only our Acharya told, Nagari Nagara Sevarata Sevaratiyataha. So Swasharirasya Medavi. Not only this, if we take the importance of Sastarkar Ayurveda, what they told, Najantu Kaschidamaraha Pritibhyam Jayate Kvachit. So according to Sharangadhara, he told that it is impossible to prevent the death. Everyone in a life, when we used to take birth, then that is a rule. But we can prevent the diseases. We can prevent the diseases just following the Trayopastamba and Dinacharya, Ritucharya and Ratricharya. So in that, Dinacharya is very important. That is, get from Dinacharya. Our Acharya explained from getting up, when we have to get up to night, what we have to do, certain rules and regulation. Our Acharya told, if we follow that rules and regulation, that is the key of health. Okay. So then if we take the just the Purusha Lakshana in the Charaka Samhita, Ashtanindika Purusha, Charkacharya explained about who is healthy and who is called as a Swastha Purusha. If you take what the Acharya told, Samamavansa Pramanastu Samasamhanano Naraha Dhudendriya Vikharanam Na Balinadi Vuyate Shukti Pasa Saha Shita Vyayama Samsaha Samasakta Samajaraha Samasanchayo Atah. So what we have to take here, why we are studying this, because Samamansa Pramanastu nowadays the trend is going on that whoever having the six packs, who is the, if the lady comes means who is having a zero figure, they only consider as a healthy, and BMI and all, that is all different. The this one is told by our acharyas with a beautiful quotation that Samamasa Pramanastu, that is, the person should have a compact body, and along with the mamsa should be distributed equally. Okay, so if you take example of North Indians and South Indians, we are basically Dravidians. Okay, South Indians, that is Keralites, Tamilians, Telugu, Karnataka, all these, we are all are Dravidians. If you take a go North India, they were completely different. Their breed is different because they were basically, their genes is Arya. So they, if you take the body structure of them is completely, they were tall and slim. If we come to Dravidians, that is South Indians, we are in the short and the short. We have to accept our body. That's only our Acharya try to tell that Samamamsa Pramanastu. We should not, so Mamsa should be equally distributed. It is not compulsion that you should maintain BMI below 25. That is within the 25 and all. Okay, so that is lean build and all. So what they told that is sama mamsa, equally distribution of mamsa should be there, and Dudendriya Vikharanam. Dudendriya Vikharanam, what we have to take here. See, nowadays in childhood only the children are using the spectacles. Usually the saying is there that Chalis Chalis. Chalis, that is a spectacle, should be used at the 40. But nowadays at a 4-year child, you can see that they were using a Chalis. That is all because of hampered lifestyle. We are not following our proper lifestyle. So, and also the Acharya told that Shut Pipasa Saha Shita Vyayama Samsaha. Shut Pipasa Saha Shita Vyayama Samsaha. If we are not feeling well, if we won't follow circadian rhythm, that is night time, night is there for a sleep, day is for a work. What we are doing now, night whole day, like a owl, we used to wake up. So because of that, night time we used to feel hunger. We are hampering our hormones. So because we can't sustain that Shut Pipasa, who used to sustain. See, if I take example of a diabetic patient, they feel hunger, they want within a half an hour or 1 hour, they feel a giddiness. So even during a prayer, we can see that the youngster used to fall within between the prayer. All this because they were not following the lifestyle. That's only who is healthy, who can sustain Shut Pipasa, and also Shita Vyayama. If you do extra work today, that you have to sustain. That is only Shita Vyayama Samasaha Samasapta Samapakta Samajara. So you have to digest whatever you have eaten along, not only digestion, the assimilation of that one is also important. So assimilation, that is see, digestion is a process. The whatever you used to take rasa, that is ahara rasa, it has to assimilate and it should be absorbed by your tissues. Then only it is called as a proper digestion. When it is all these things will be there, then only you are considered as a healthy swastha purusha. But nowadays, what is going to happen? We are witnessing gestational diabetes, juvenile diabetes. The children are more addicted to junk. They want, they won't go for a fruits and all. Carbohydrate intake is more. See, if the sugar present in a fruits is completely different. What we are taking the sugar, that is completely, that is a direct glucose. The sugar present in a fruits is a fructose that used to control our mood swings, and it will the sugar content in a fruit will be rapidly absorbed. Not only rapidly, it is having an anti-aging property, antioxidant property. But nowadays, because children are not going outside, they were not playing. It's not the question of lockdown. Before also, our children are like that only. They were stressed out completely. There is no playtime for children. The relaxation for children nowadays is TV and gadgets only. See, if they do homework or if they eating, even taking a food is a favor for parents nowadays. Okay, so all these, because of that, we are witnessing juvenile diabetes, addiction, and also addiction to mobile, especially the cell phone. Children are very addicted. Not only that, even cancer we are seeing in the children's. Majority of women also witnessing so many types of cancer, autoimmune disorders. All these are very common. Even nowadays, we are all of us feeling this one because we are whole day the housewife or mother used to work. After that, for the relaxation, everyone is addicted to YouTube and WhatsApp and all. So because of that, the secretion of melatonin won't take place. Whenever the low melatonin won't be there, then we won't get a sleep. Okay, so if you won't get a proper sleep, then that is see, always we have to remember that sleep is main thing to improve our health. The quality of sleep is a secret of our health. And also in our hospital, we used to get so many patients who want for a weight loss. They used to do that. They used to do asanas, and they used to go for a workout. Then also they were not reducing their weight. It's just because they won't do proper and quality sleep. Okay, so sleep and weight loss are interlinked. Everything good happens. That is, when you used to take a proper sleep, that good thing would happens while you sleep. So if we compromise 1% of a sleep, see, just 1% of a sleep, if you compromise, if you won't take a quality sleep, it causes so many problems. Just if you not slept properly, then you can see the effect at a morning itself. Okay, so everything starts from, see, our body is made up of billions of cells. Each and every cells used to communicate each other. Okay, so our organs, tissues, all these are formed by the cells. Each cells used to communicate each other. If one cell is not happy, then it used to give that message to other cell also. Because of that, we are suffering of so many autoimmune disorder. See, if one imbalance, if one cell is not happy, then that used to create a imbalance, and that all originates from each and every billions and billion cells won't be happy. That all problems used to create a see, if you take a stressed out, if we won't sleep properly, we'll be stressed out. Whenever we used to be stressed out, that damages our cells, that increase our cortisol level. Whenever cortisol level increases, that high cortisol level binds with the estrogen. Okay, so estrogen, what happens? High estrogen level, it used to bind with the thyroxine. So majority of us, if we see that the girl attaining the menarche, all of majority of girls are nowadays, they were suffering from PCOS, thyroid problem. It's all because of sleep. If you won't take a proper sleep, or if you are stressed out, what happens? They were interlinked. So thyroid problem. So estrogen, the damage of cell increases the cortisol. Cortisol level increases means that cortisol level increases the estrogen. Estrogen used to bind with the thyroxine. When it used to bind with the thyroxine, the thyroid level used to increase. The thyroid inhibits us to lose a weight. That is the main thing. That thyroid, when thyroid level increases, that inhibits us to lose the weight. Once we used to put on, that all used to cause all kind of diseases. See, we can see from all diseases, that is, we may take all diseases which are related to autoimmune diseases from thyroid, blood, GI tract, all these are interlinked if we want to follow our dinacharya. Dinacharya is the basic thing which we have to follow. Then only we can keep ourselves healthy. Okay, so now we are going to deal with the yoga. So after that we use link all together. So if you take the word meaning of yoga, yujyate aneniti yoga. So yujyate means to connect. To connect. So the question arises, to connect what, to connect whom, to connect, connecting ourself. Okay, so once if you know to connect yourself, then only you can connect with the whole world. Okay, so when we know that how to connect ourselves, when we know the method to go inside that, we have to go ourselves inside and explore what you are, then only we can manifest outside. So the nowadays the wrong notion is there that yoga, see today we are dealing with the yoga in overall health. So unfortunately the people used to think that yoga means it's a good exercise which useful. Just now you people completed yoga, that's just a part of yoga. That is asanas is a part of yoga. So what we are thinking that yoga means it's a boost exercise which used to keep us slim and which maintain our BP, sugar level and all. That's okay. That is a part. But yoga is vast. It is just yama, niyama, asana. What we studied till now, that is dinacharya. In dinacharya, our acharya told about some rules and regulation to maintain dinacharya, when we have to get up, what we have to do after getting up, all these things they told in yama, niyama, so all together yama, niyama, asana, pranayama, pratyahara, dharana, jnana, samadhi, all together is called as a yoga. Single, if you do asana, we can't maintain our health. So when we can maintain a health, how it yoga used to affect our health, when we used to follow all this Ashtanga yoga, when we used to follow, then only we can maintain the health. So if you take an example of yama, they told about ahimsa, satya. So all these, if you maintain the satya, if you won't lie, see, we can lie with others, but if you lie yourself, then that used to affect your cell. Each and every cell used to listen. If you lie to others, what happens? Always we used to think, we told like that, but the truth is different. So that cell used to listen that thought, and that will be a negative energy used to be generated, and that used to transfer to other cell. So that's only they told that we have to follow satya, ahimsa. So brahmacharya, aparigraha, daya, all these are a yama, and even they told about a niyama. Niyama means one should follow by ourselves. That is only swasharirasya medhavi, maintaining of hygiene. So here they told about the shaucha, santosha, ishvara pranidhanya, swa adhyaya. So all these, see, they are, that is yoga, ayurveda, it's completely interrelated. Okay, so niyama, they told about the maintenance of hygiene. When we used to maintain hygiene, then we can prevent communicable diseases. Okay, so that is only they told about the shaucha, santosha. If you are happy, then you can vishadho vyadi ruddhikaranam shrishtam. So if we are do vishada, then it's that day itself we are inviting a disease. If we are happy, then we can prevent a disease. That's only they told in the niyama, shaucha, santosha, ishvara pranidhana, swadhyaya. Self-analyzing is known as a swadhyaya. So that all we have to follow, then only we can maintain. Next one is asana, what you did now, that is asana. So asana, it increases whole body activities. It used to increase. Next, pranayama, it increases breathing capacity. So, and also it reduces the stress and it balances the hormone. This all is a pranayama. These four are called as a Bahiranga Yoga. Next one is a Antaranga Yoga, that is a Dharana Dhyana Samadhi. Okay, always if you just now you have attended the yoga class, in that your yoga teacher might be told that observe your breath, observe your breath. Whenever we used to attend a yoga class, the yoga teacher used to ask you to listen your body, observe your breath, do it slowly. So why they used to do? See, being aware of your body, when you used to observe your body, whenever we are doing Shavasana or Thadasana, any asana if you take means, we have to observe our body. When we used to observe our body, our health used to improve. Okay, so when we have to observe, nowadays we are observing others only, we are not focusing ourselves. When we used to focus what happened, see if we take an example of a breast cancer, majority of women they don't know that the lump is formed in their breast only. That much they were busy, they won't observe the changes in their body. So if we get only we are observing the externally, if a hair fall will be there, acne will be there, that much only we are observing. If something happened, knee joint pain, if your abdomen is protruded, all these things we have to observe. Obesity, it won't come in a one day. It takes so many years together, then only we can get obese. So when it is started, then only if we observe our body, then it will be our health might be improved. That's only Acharya told. So that in yoga, always whenever we are doing the asana, we used to tell observe your body. So by observing our body, our health used to improve. By being aware of our breath gets regulated, so that our pranamaya kosha used to increase. And by being aware of our mind, emotions get, whenever we know we can control our thoughts, we can't change others thoughts, but we can change our thoughts. So don't allow yourself for a negative thoughts. Okay, so when we used to think and we used to observe our mind, we can control our emotions. Okay, that is only manomaya kosha. When we used to being aware of our intellectual, that is Jnanamaya Kosha, then only start blossoming, that is intellect start blossoming, that is Anandamaya Kosha. That's only yoga they told about Annamaya Kosha, uh, Pranamaya Kosha, Manomaya Kosha, Vijnanamaya Kosha, and Anandamaya Kosha. If you want to attain Anandamaya Kosha bliss, first thing you have to observe your body physically and mentally and emotionally and spiritually. When you are strong, then only it will be bliss. Okay, so next, whenever we are doing asana, asana it's not a exercise, it's a complete different thing. Okay, so whenever if you take an example of simple Surya Namaskara. So Surya Namaskara, it is of 12 asanas will be there. It's starting with Namaskara asana, Hasta Uttanasana, Pada Hastasana, Ekapada Kasanasana, Dhandasana, Ashtanga Namaskara. So series of asanas will be there. In first asana, always try to remember that. See, always there should be a mind and muscle coordination should be there. So exercise simply, if we raise your hands means we used to raise. We did in our school days that the drill PT classes will be there. If they ask to raise your hand, you used to raise. If they ask to jump up high, you used to jump. If they ask to lift your leg, we used to. But it's a completely different. What we used to do in the asana, there should be coordination with your body being. You have to observe your body. When we used to go for a hasta uttanasana, we have to inhale. Always the basic rule in a breathing pattern asana is, whenever we used to inhale, we used to take away from the body. See, hands away from the body, leg, head away from the body. This is Hasta Uttanasana. Here we are inhaling. So when we used to take away from the body, our chest, that is lungs, used to expand, so that we used to get the abundant oxygen. Okay, so exhaling, come down, inhaling, go up, exhaling, come down. When we used to come down, it used to constrict. See the beauty of Surya Namaskara. See, synchronization of breathing will be there. See, inhale, exhale. Here once again we used to inhale because we are opening up our chest. That's why it is inhalation, exhalation. Once again, here we are in Ashtanga Namaskara. We are withholding our breath. Kumbhaka we are doing. Just we are surrendering completely Surya. Okay. That's why Hiranmayena Patrena Satya Pihitam Mukam. Tattvam Pushan Aparonu Satya Dharmaya Drushate. Here in Ashtanga Namaskara, completely surrendered to Surya. Next, once again here we exhale, here once again we used to inhale. So it's a complete synchronization of pranayama and asana. Whenever you used to observe your physical gesture along with the pranayama, that is breathing, there itself you used to get a complete health. Let us discuss about the benefits of yoga. So when we used to do proper yoga, we can now I can tie. I would like to tie all these whatever we studied about the autoimmune disorder and all life is a game of hormones. When hormone imbalance takes place, majority of we used to invite all diseases, that is communicable diseases, non-communicable diseases, all used to. Whenever imbalanced used to takes place, we used to suffer from right from hair fall to cancer. You can take diabetes, cancer, hair fall, acne, discoloration. All these used to happen just because imbalance of hormones. Imbalance of hormones used to take place when we won't feel happy. Okay, so when we used to do yoga properly, it used to give us well-being, enhance the well-being. See, always feel happy hormone. We used to call it as a feel good factor. We need to do feel good. When we used to feel good, whenever serotonin and endorphin hormone used to release. Okay, so yeah, whenever we used to take while working in Bangalore, we used to our college is having a tie-up with Nimhans hospital. That time, so many majority of depression patients we used to see. Depression patients, we first and foremost thing we used to ask for a depression patient just to take a walk for a 1 kilometer. So regularly for a week they used to take a walk. After that, we used to call them and ask how they were feeling. So they will tell that they were feeling good. Why? Because whenever we used to go for a walk or any kind of a physical exercise, what happens? Endorphin used to release. So endorphin and serotonin, all these are feel good hormones. Whenever, see, nowadays we are not at all feeling good just because we are not doing the physical exercise. So see, usually whenever you used to see the YouTube or mobile, anything WhatsApp, then only if we are feeling good, or if you take moments, if they start with a coffee or a tea, then they used to feel happy or feel good. So that is not a reality. So reality, that's a simply fantasy. We are living in a fantasy world that if we drink tea, then only we feel good. So that's not a reality. So reality is that when you used to train your body, train your mind with the yoga and asana, then only feel good hormone used to release. Okay, and also stress level used to decrease. Even we can take an example of uh, diabetic patient, if a diabetic patient usually see before diabetes, they won't they won't have a craving of eating sugar or a carbohydrate. But once the patient come to know that they were suffering from the diabetes, their craving of sugar and carbohydrate used to increase because they were sending the cell the energy that they want, that they can't eat that. Whenever we stop that, then we want a craving that. So that craving used to reduce when we used to do yoga and asanas. Okay, we can correlate each and everything, even from right from cancer to all these things can be reduced with simple following proper breathing method and a proper asanas. Always see, we are having a different lobes, that is frontal lobe, partial lobe, occipital lobe, the parts of brain if you take means frontal lobe. Whenever we used to do balancing of asanas, okay, so frontal lobe, the action of a frontal lobe is planning, emotional regulation will be there, personality and behavior thing, all these will be controlled by our frontal lobe. Usually during yoga classes, what we used to do, we used to make them to do balancing asana. When we used to do balancing asana, your frontal lobe used to be regulated. Like that only in a partial lobe, if you take means the partial lobe, the touch sensory information used to regulate even language processing, all these used to take. See, if children, if they can't walk properly, they used to try to balance while walking, all these because our they were growing, their lobes are growing, so they required all these things. That's why the child used to walk on the tiptoe. Same thing we used to see. If you are standing in a tadasana, just a simple standing asana will be there, but while standing we have to observe our whole body. When we used to observe our whole body, we can look at all these, that is frontal lobe, partial lobe, these all are the centers for a speech, emotion, all these used to regulated when we used to do properly the asanas. Okay, so now we are going to focus the main important thing that we are going to talk about an inexpensive, freely available that all of us are using. Most all of us don't use it properly. That is a breathing pattern. That is a oxygen. Okay, so oxygen is considered as an elixir of health. Each and every cell required a proper amount of oxygen. Even after taking so many medicines, that medicine assimilation won't take place just because proper oxygen won't be there in our cell. Okay, breathing is a process that is we rarely used to give thought. When we used to come to know that we are breathing, just it's an we are taking granted process. It's the granted one. Always when we want to lift our hand, then only we used to lift our. Once in a day, we have to do breathing according to our mind. When we want to inhale, we have to inhale. When we want to exhale, we have to exhale. That we have to do once in a day. So as per Hatha Yoga Pradipika, life is a period between one breath to next. So a person who only take a half breath, half life will be there. Okay. So if you are taking a shallow breathing, if you are not doing breathing properly, our lifespan, here lifespan, what we have to take nowadays, lifespan is increased just because after 50 everyone are taking the medicine for a sugar and a BP, and their lifespan is in. So without medicine, if your lifespan is increased, then that is known as a health. Okay. That's only we get a reference in Mahabharata also. That is Sattva Raja Manasaha. These are Sattva Raja Tama. These three are bhavanas. So when we used to do properly the yoga and asana, we can control over this. That is Raja, Sattva, and especially Rajasika and Tamasika guna we can control. So let us see the breathing pattern is the most important thing in our yoga part. Okay, so breathing, if we see that it is having the two process, that is inspiration and expiration. When we used to inhale, what happens? Our diaphragm used to contract, used to move down. Okay, the diaphragm used to move down and the rib cage used to expand, so that the lung used to expand. Okay, this is how the inspiration process takes place. Whenever you used to expire, what happens? The diaphragm moves up. Usually the diaphragm moves up and it used to relax, and the rib cage, what happens? Used to constrict, and so that the air used to come out. That is how we used to do breathing. But nowadays, what we are doing, all of us are doing the shallow breathing only. Our breath won't reach up to diaphragm. Whenever we used to inhale, our abdomen has to come out. When we used to exhale, our abdomen has to go inside. But we are, all of us are doing the chest breathing only. So if you see the objectives of breathing, here we have to train ourselves for the utilization of all those lobes of lungs. We know that our right lung is having the 3 lobes, left lung is having the 2 lobes. So whatever we are intaking the oxygen, it has to reach all lungs. So why we are focusing the oxygen here this much means, see, whenever our oxygen level used to increase, whenever we used to do diaphragmatic breathing, what happens? It increases our immunity. See, oxygen, immune system and oxygen are interrelated. When we used to get more oxygen, when we used to retain more oxygen in your body, it strengthens the T cells. All of us know the role of T cells. T helper cells used to recognize the antigens, whoever, whatever it will be. So it strengthens the T cells memory. The oxygen used to strengthen the T cell memory, and which is the immunity, and also lymphocyte production used to increase. Lymphocyte production is considered as our immunity. So whenever usually immunity, T cell and lymphocyte count, that is WBC, and all used to be reduced. There is a fall in a cancer patient, in a HIV patient, in majority of autoimmune diseases, wherever the immunity will be lessened, there we used to see all these things. Just simple breathing, if you properly breathe, oxygen level increases, means it helps for the T cells memory and also production of lymphocytes. So what we have to do, we have to train ourselves for the utilization of all lobes. That is only, it is called as a Dirgha Pranayama. Okay. So it is of 3 types, especially clavicular breathing, thoracic breathing, and abdominal breathing. Let's see about abdominal breathing that we can do daily. That is, just you have to keep your hands on the stomach. Inhale completely. Try to inhale completely. When you inhale, first chest has to come up. Next, your abdomen has to come up. That is a proper breathing. Okay. So when you used to exhale, try to do now only. See, inhale completely. Abdomen has to come out. Exhale, abdomen has to go inside. Just this one is called as a diaphragmatic breathing. So to improve our health, what we have to train each and every patient, not only patient, for us also, it is a must needed one. We have to practice 5 to 6 times while sitting in the office, while doing our work. Only 4 to 5 times if you practice every 2 to 3 hours once, that used to increase our oxygen level. See, usually what happens, your tidal volume, how much we used to inhale our breath while we used to take inhalation, the oxygen level, that is a tidal volume in our lungs, will be 500 ml. That is a half a liter of oxygen we are taking. When we used to do diaphragmatic breathing, that your abdomen used to come out, that time we can increase 8 times of oxygen level. Okay, oxygen level used to increase if you do diaphragmatic breathing. Okay, fine to do this one. Anytime you can do whenever you are free, and so 2 to 3 hours once you have to inhale properly. So just it's a breathing proper method is known as a Dirgha Pranayama. Okay. Next one is the current burning issue we are touching, that we are knowing that proning, that is proning, lying up down is called as a proning posture. Nowadays, for COVID patient, we are, even our government has given a guidelines for a proning posture, how to lie down, how to even they have demonstration videos we are getting. That's only called as a Makarasana. Why we have to lie down in a proning posture? Just because the major part of our lungs lie on the back only. So if you lie down on your chest, what happens? It will be the compression over your chest. If you lie down simply on the back, what happens? The compression over chest will be more, so lungs will be compressed totally. So whenever we used to lie on our back, that the compression takes place. When you used to lie on your stomach, what happens? So usually the stomach, the major part lie on the back. No? So when you used to lie down on the stomach, it will be free and lungs used to be expanded. That's only the simple Makarasana, Vacha or Acharya told. Okay? So, and my best advice for you people that don't learn yoga from YouTube or from yeah, any TV or in a group. Mass yoga is completely different. Each and every body is different. Each and every constitution we are having different. What Prakriti is different according to our Prakriti, which is suitable for us. That asanas only we have to do. If chakrasana is suitable for someone, someone they can't do. So don't force your body to do yoga or asana which you can't do. Gently with love you have to do the asana. There should be a mind and a muscle coordination should be there. Then only we can improve our health. Okay. So take home message for this today's session is everybody can breath. So everybody can take a breathing. So therefore everybody can practice yoga. Okay. So it's not a thing that we can't do yoga and all. So everybody can do. So that's only Acharatu Stiram Sukham Asanam. Anybody, which one is Sukha, which used to give to Sukha, only that only we have to do. That is, everybody can breath.
Mic on ಮಾಡ್ಬೇಕೇನು?
Yoga. It's never too late, it's never too old to start a practice. Whenever you want to start, if you want to start your 40s, if you want to start your 50s, you can start. Okay, it's never too late, it's never too old. Start a practice yoga. You can
Hello?
start with, hello, hello. So next, don't force your body to do yoga. Gently do yoga. And the last one, that eat smart, move most. So don't go simply sit. Try to work. Sleep right. Proper sleep is a key for a health. So hormone balance takes place. Breathe deep. This is the take-home message from today's session. So yoga, calming the mind is yoga, not just standing on the hand. It's a wrong notion that yoga means only we are not stick to the asanas altogether. Ashtanga yoga, that is yama, niyama, pranayama, asana, pratyahara, dharana, dhyana, samadhi. Calming of mind, controlling of mind is a yoga, not just doing like a exercise is a yoga. Okay. This is all about yoga in maintaining the health. Any doubt in this? Over to sir.
Any doubts, students? Samskruti?
Yes.
Any questions from student side? Please, you can ask.
Okay, sir. If anyone has questions, please, you can.
So, my request to all doctors that for in every prescription you have to include a pranayama. You have to train your patient regarding the pranayama. When they know to do proper pranayama, breathing exercise, your medicine is going to affect. Assimilation of medicine or assimilation of ahara takes place whenever we used to supply abundant oxygen to cell. Okay, so try to, as we are Ayurvedic doctors, try to write down the pranayama in your prescription.
Thank you, ma'am,
Thank you.
for helping us become more aware about the subject. And we are truly humbled this contribution to this lecture. We are sure that this will be beneficial for us forever. Thank you so much, ma'am.
Thank you. It's my privilege, and I want to thank you once again.
Very good morning to one and all. Wish you all 7th International Yoga Day. Just now Dr. Sangeeta Madam has explained very nicely regarding the yoga, pranayama and asanas. So today in this pandemic year, everyone came to know what is the importance in our life. Not the money, name, fame, but only the health. And it is said that health is wealth, which we get peace and health by this yoga. I am very enlightened to our beloved Prime Minister Modi ji for making the world awareness of this yoga by celebrating on the 21st of the June as the Yoga Day. So on this behalf, our college has conducted many essay competitions, poster competition and photo competition. I am very glad to announce these results. So first essay competition, first place goes to Miss Veena SM, the DGM College of Gadag. And the second place goes to Akshay Khanna, Baba Ki Ayurved Medical College, Punjab. And the third place goes to Miss Kavya Shankar Narayana, Sri Jainendra Saraswati Ayurvedic Medical College and Hospital, Tamil Nadu. And the second, now for the poster presentations, the results are Miss Suvicharna S. Sharma, SPG Ayurvedic Medical College, Belgavi. And the second place goes to Shashireka A, SBG Ayurvedic Medical College, Belgavi. And the third place again goes to Veena SM, DGM Ayurvedic Medical College, Gadag. And the third competition, that is the photo competition result, the first prize goes to Mr. PM Bhargav, Sri Janendra Saraswati Ayurvedic Medical College, Tamil Nadu. And the second prize goes to our college, that Mr. Brahmanand Pattar, Gramin Ayurvedic Medical College, Terda. And the third prize goes to Miss Gauri Ghate, Bahusaheb Mahak, Ayurvedic Medical College, Nagpur. Thank you.
Thank you so much, ma'am. Now I would like to call Dr. Usha Kala Patil, ma'am.
Very good morning to all. It's my immense pleasure to say a vote of thanks on this occasion. First of all, I would like to say thanks to our Honorable Prime Minister Narendra Modi ji for his grateful support to Ayurveda. Next, I would like to say thanks Dr. J.B. Algur sir, Secretary Gramin Ayurvedic Medical College, Terda. Thank you, sir. Next, I would like to say thanks to Nilesh Desai sir, Treasurer Gramin Ayurvedic Medical College, Terda. Thank you, sir. Next, I would like to say a special thanks to Dr. Sangeeta Balganur, Associate Professor, Department of Swasthavritta, SKA, M. College, Badami. Thank you, ma'am, for your valuable speech. Next, I would like to say a special and heartily thanks to our beloved principal, Dr. L.M. Biradar, Gramin Ayurved Medical College, Terdar. Next, I would like to say thanks to all teaching, non-teaching, hospital staff, and my dear student. Thank you once again. Now, end this session with national anthem. So let us stand, all of you, for national anthem. जनगण मन अधिनायक जय हे भारत भाग्य विधाता पंजाब सिंधु गुजरात मराठा द्राविड उत्कल बंगा विंध्य हिमाचल यमुना गंगा उत्कल जलधि तरंग तव शुभ नामे जागे तव शुभ आशीष मागे गाहे तव जय गाथा जनगण मन अधिनायक जय हे भारत भाग्य विधाता जय हे जय हे जय हे जय 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 हे भारत माता की
Thank you so much, ma'am. Here I would like to announce that we have successfully completed the program. Thank you everyone for attending the program. Thank you so much.